The White House calls this a game changer, the major industries in the healthcare debate coming together and pledging to voluntarily reduce healthcare costs by $2 trillion over the next decade. The White House says this means healthcare reform will happen this year.
Skyrocketing healthcare costs mean economic doom for couples like Daniel and Judith Russo, who pay for their own insurance.
We're depleting what would have been our savings for retirement. We're spending our retirement pre-retirement age.
Today, some of the same industries that helped sink healthcare reform with those Harry and Louise TV ads back in the 90s.
There's got to be a better way.
Are coming to the table with solutions. Hospitals, insurance companies, drug companies, doctors, business and labor will commit to cutting costs by 1.5% a year for a decade. Within 5 years, the White House estimates, a family of 4 could save $2,500 a year.
If we don't address costs, I don't care how heartfelt our efforts are, we will not get this done.
And with those savings, those tens of millions of Americans without insurance will hopefully be able to get it. But where will these savings come from? White House officials herald a study from Dartmouth of why the same health care coverage can cost up to 3 times more in one part of the country than in another, with no better result. Dr. Elliot Fisher was the study's principal investigator.
We can actually spend less and get better care and better health.
Potentially huge savings from better coordination, with your primary doctor serving as a sort of coach, keeping track of your health. Changing financial incentives so medical providers are no longer encouraged to do the unnecessary.
Much of healthcare spending, probably 30% of it, is devoted to unnecessary stays in the hospital, to unnecessary diagnostic tests, to unnecessary referrals to specialists, or more frequent visits than patients need.
The Russos hope all of today's talk is real.
I find it frustrating to be punished by the system that I've played by the rules.
We should point out, Diane, that these healthcare industries are not doing this out of the goodness of their heart. They want a seat at the table so they can fend off things in the healthcare plan as it's being written. For instance, the health insurance industry wants to make sure that there is not a private plan to compete with the government plans.